Hello everyone, my name is Celinda Allen from Winston-Salem State University's Clinical Laboratory Science program. Oftentimes, researchers find ways to better laboratory testing and procedures for better workflow for laboratory personnel and for patient care. It is our job as lab professionals to recognize areas in the lab that need improvement. Can you think of any areas that need an improvement? Today, I am here to present my proposal on extension of platelet storage by manipulation of temperature. So you ask, why are platelets such a hassle? Platelets can be expensive, have a short shelf life. Due to increased temperatures, it is at increased risk for bacterial contamination and a greater risk for transfusion reactions. Currently, platelets are stored between 20 to 22 degrees Celsius for only 5 to 7 days. Researchers have tried to make several changes, including cold stored platelets, cryopreserved platelets, and platelet additives. Platelets are used to treat or prevent thrombocytopenia, for surgical trauma, and for massive blood loss. The military has used cryopreserved platelets in previous years. Cryopreserved platelets are stored at negative 80 degrees Celsius for 2 years. They have used cryopreserved platelets on the battlefield, on human trials, but they aren't ideal for all laboratory practices. After the platelets have been frozen and thawed, they're only good for 4 to 6 hours. It takes about 45 minutes to prepare before transfusion. Hospitals and or facilities do not have freezers that's negative 80 degrees Celsius. The FDA has approved platelet additives such as Intersol and Isoplate to be used to help extend platelet storage, but due to limitations in studies, there haven't been many advances in these methods. Then there is cold stored platelets. Cold stored platelets are platelets stored at 4 degrees Celsius. Cold stored platelets have been proven to improve platelet activity, increase shelf life up to 15 days, have better aggregation, and improved hemostatic function. Cold stored platelets also increase cellular morphology and increase platelet counts. Due to limited human trials and in vivo studies, researchers are still monitoring ways to extend the shelf life and maintain optimal platelet functionality. For my proposal, my colleagues and I plan to use a passive observation method to compare in vivo and in vitro assays of room temperature platelets versus cold stored platelets. We plan to use Charlotte's largest hospital, which is CMC Maine, to perform our study. The FDA has approved cold stored platelets to be transfused on patients that are actively bleeding. We predict that around 300 patients will be transfused in 3 months. We will alternate between cold stored platelets and room temperature platelets and perform in vivo and in vitro studies to help us answer our basic question, which is which temperature is best to extend the shelf life while monitoring the best platelet functionality. We plan to hire or train separate staff for this experiment. Nurses will also be involved in this experiment. The nurses will be instructed to have a signed waiver for patients that are participating in the experiment. The CBCC will supply and store the platelets for this experiment. The CBCC is located right next door to the hospital. They will supply the lab with a sample of whole blood from the platelets from each bag using a Buffy coat method. They will separate and store the platelets at 4 degrees and 22 degrees Celsius. In vitro analysis will be performed each day on the platelets that are waiting to be transfused. In vivo testing will be performed after the platelets are transfused into the patients. Cold stored platelets can be kept from 1 to 21 days. Room temperature platelets can be kept up to 5 days. Staff will be trained to discard the platelets after they've been out for their maximum storage time. We plan to include testing such as flow cytometry, blood gases, and the use of an automated hematology analyzer. The flow cytometry is used to analyze platelets circulating in vivo and monitor platelet aggregation. The ABL 90 Flex radiometer is a blood gas analyzer used to monitor platelet metabolism, such as the pH, the CO2, and O2 parameters. The DSH 520 is an automated hematology analyzer. This will be used to do our automated platelet counts. With our blood sample, we will make slides and stain them with right stain to be able to look at the cellular morphology of the platelets. Our data will be compared using t-test and ANOVA testing. Our statistical analysis will be achieved by using the SPSS computer software system. We predict that around 150 successful cold stored platelets will be transfused. We also predict that cold stored platelets will be the best temperature to use for the extension of platelets, shelf life, and for the best functionality of platelets. I have enjoyed speaking with you today. If you have any questions, please let me know, and have a great day. Thank you.